Welcome to the deep dive. Today we're getting into a really important topic, cerebral palsy, or CP.
That's right.
Think of this as, well, your way to quickly grasp the essentials. We've looked through information from Nemours Kids Health, the Cleveland Clinic, and we also took a peek at how Mayo Clinic approaches diagnosis and treatment, just focusing on those core ideas.
Yeah, pulling out the common threads there.
Exactly.
Yeah.
So our mission today is really to unpack what CP is, what might cause it, how doctors spot it,
The different ways it can affect someone.
and of course, the kinds of support and care available. We want to give you a really solid foundation.
Without getting too bogged down in, overly technical stuff.
Precisely. So let's just dive right in. The big question first. What exactly is cerebral palsy?
Okay. So the simplest terms, cerebral palsy is a neurological condition. It affects muscle tone, movement, and coordination.
Neurological, okay.
Yeah. And the core issue is that the brain has trouble sending the right signals, the movement signals, down to the muscles.
A communication problem, essentially.
Exactly. It usually stems from problems with how the brain develops, often before birth or, in very early childhood.
And it's not just one single thing, is it? I think the sources called it an umbrella term.
That's a great way to put it. It's an umbrella term for a group of disorders that all share similar effects on movement and posture.
Okay, so it's about how the brain talks to the muscles for movement.
Yeah.
But does that communication issue affect other things too?
It definitely can. That difficulty with brain signals, it can impact other functions that need muscle control. Things like breathing, sometimes bladder and bowel control.
Eating, talking.
Yes, eating and talking too. It's all potentially connected through that muscle control aspect.
Got it. Now, one thing that seemed really crucial from the sources, cerebral palsy doesn't actually get worse over time, right? The underlying issue is stable.
That's a really key point. Exactly. The initial brain difference or injury doesn't progress. Now, how CP impacts a person can change as they grow and develop, but the fundamental condition itself stays the same.
That's important to clarify.
It is. And what's also striking is just how differently CP can present itself. There's quite a range.
Yes, the sources broke it down into different types. Could you maybe walk us through the main categories?
Sure. So they're often grouped by the main type of movement difficulty someone has. First, there's spastic CP. That's probably the most common.
Spastic meaning stiff.
Yes, stiffness, difficulty moving muscles smoothly. Then you have dyskinetic cerebral palsy, which sometimes gets called athetoid.
And that involves?
Uncontrolled movements. They can be slow and writhing or maybe more rapid and jerky. It fluctuates.
Okay.
Then there's ataxic CP. This type mainly affects balance and coordination. Judging depth, like how far away something is, can be tricky.
Right, problems with balance and that spatial awareness.
Exactly. And lastly, there's hypotonic CP. This is characterized by low muscle tone. The muscles might feel kind of, floppy is a word often used.
Floppy. Okay, so spastic, dyskinetic, ataxic, hypotonic, different movement challenges. And I also saw CP classified by which parts of the body are affected.
That's right, another layer of classification. So diplegia usually means the legs are more affected than the arms.
Legs more than arms.
Although, interestingly, the Cleveland Clinic did note sometimes it can affect the arms more, so there's variability even within that term.
Okay, good to know.
Then, quadriplegia involves all four limbs, arms and legs.
Quad 4. Makes sense.
Hemiplegia affects one side of the body, so either the right arm and leg or the left arm and leg.
Hemi, like half.
Right. And then there's monoplegia, which is just one limb affected, and paraplegia, which specifically impacts the legs.
Wow, okay. That really paints a picture of how varied it can be. And someone could have a mix of these types, couldn't they? Like spastic and dyskinetic features.
Absolutely. Since brain injuries or differences can affect multiple areas, it's definitely possible, even common, to see a mix of movement disorders in one person.
It just really drives home how unique each individual's experience with CP must be.
It really does.
So turning now to, what causes CP? It sounds like pinning down one specific cause isn't always straightforward.
That's often true. In many cases, the exact cause remains unknown. But the sources do give us a good idea of the potential factors involved, especially during pregnancy and early infancy.
It all comes back to that damage or difference in the developing brain, right?
Precisely. And that can happen for various reasons. During pregnancy, things like infections or certain medical conditions the mother might have can play a role.
Okay.
A stroke, either happening in the womb or very soon after birth, is another possibility.
A stroke in a baby, wow.
Yeah. Also, untreated jaundice, when babies look yellow, If it gets severe, it leads to a condition called kernicterus, where bilirubin builds up and can damage the brain. That's a known cause.
Kernicterus, right.
Genetic disorders can sometimes make a child more likely to develop CP, exposure to certain toxins like lead.
Lead poisoning.
Yes, infections affecting the brain like bacterial meningitis, or just not enough blood flow getting to the brain during development.
And tragically, injuries too.
Unfortunately, yes. Things like shaken baby syndrome or serious accidents can cause the kind of brain injury that results in CP. And though it's less common now, complications during the birth process itself can sometimes be a factor.
It seems like there are also things that increase the risk, even if they don't guarantee CP will develop.
Correct. Big risk factors include being born prematurely, especially very early, like before 28 weeks,
Prematurity is a major one.
and low birth weight, typically under about 3.3 pounds. Also, being part of a multiple birth, like twins or triplets.
Why multiple births?
Well, they often come with higher risks of prematurity and low birth weight themselves. The Cleveland Clinic also mentioned things like substance use during pregnancy or conditions the mother might have like preeclampsia as potential contributors too.
Okay. What about causes after birth? Are there things that can happen later in infancy?
Yes, definitely. While damage before birth is the most common, maybe around 80% of cases, the sources suggest things can happen afterwards too.
Like what?
Accidental injuries, sadly physical abuse, asphyxiation, which is a lack of oxygen to the brain.
Asphyxiation.
Yeah. Or infections, strokes, or bleeding inside the brain that occur after the baby is born. And again, that severe untreated jaundice leading to kernicterus can happen in the newborn period.
It really highlights how vulnerable that early developmental period is. So given all these potential pathways, how is CP actually diagnosed? Getting an early diagnosis sounds crucial.
It really is. Early monitoring is key, especially for those babies we know are at higher risk, the preemies, or those with other health problems right at birth.
But the doctors are watching them closely.
Yes. They look for delays in hitting those typical developmental milestones, like not reaching for toys by around 4 months or not sitting up independently by about 7 months. Those can be early flags.
Okay, developmental delays.
They also observe the baby's motor skills. Is there trouble with crawling, eventually walking? How are they moving their arms and legs? Is it coordinated?
What else are they looking for?
Unusual muscle tone is a big one. Either muscles seem too tight, too stiff, that's hypertonia, like in spastic CP, or too loose and floppy hypotonia.
Right, the stiffness or floppiness.
Exactly. And another clue can be infant reflexes sticking around too long, like the grasp reflex. They usually disappear after a few months, but if they persist, that can be a sign.
So it's a combination of observing development and specific physical signs. Does it usually involve specialists?
Oh, absolutely. If a primary care doctor suspects CP, they'll almost certainly refer the child to specialists, maybe a pediatric neurologist or a developmental pediatrician.
Or a deeper look.
Exactly. And they use a range of tools. Detailed physical and neurological exams, of course, standardized checklists to assess development. Brain imaging is often key.
Like MRIs.
Yes, MRI gives very detailed pictures of the brain structure. Sometimes the cranial ultrasound is done first, especially on infants as it's quicker.
Okay. Any other tests?
An EEG might be used if seizures are suspected, because it records brainwave activity. Lab tests blood, urine, sometimes skin samples can help rule out genetic or metabolic problems that might mimic CP.
So ruling other things out is part of it too.
Definitely. And because CP can affect so many areas, they often do additional tests for vision, hearing, speech, cognitive function, and overall movement patterns.
It sounds incredibly thorough. But one source mentioned diagnosis isn't always immediate. It can take time.
That's true, especially if the early signs are subtle. A doctor might have a strong suspicion before the child is even 1 year old, but a firm, confirmed diagnosis often happens between 18 and 24 months.
Why the wait?
It just gives more time to see how development unfolds, to observe the patterns more clearly, and to make sure nothing else could be causing the symptoms.
Makes sense. So once diagnosed, what kinds of problems can CP cause? The Nemours info suggested the range is really wide.
It is incredibly wide. It really depends on which parts of the brain were affected and, the extent of the difference. Some people might have only mild movement difficulties,
while others face much bigger physical challenges.
Exactly. And it's not just about movement. Other issues can arise too. Vision problems, even blindness can occur. Hearing loss is another possibility.
What about things like eating?
Yes, problems with food aspiration where food or liquid accidentally goes into the lungs, that can be a concern. Gastroesophageal reflux, or GERD, frequent spitting up, is also common.
Okay.
Speech problems are frequent, sometimes accompanied by drooling. Sleep disorders can pop up. Osteoporosis, a weakening of the bones, can be a risk down the line.
Wow, it affects quite a few systems.
It can. Also, potentially behavioral challenges. And seizures epilepsy is quite common in people with CP.
Seizures too.
Sometimes differences in head size, either smaller, microcephaly, or larger, macrocephaly.
Yep.
In babies, sometimes you might see more irritability or maybe less interaction than typical.
What about intellectually? Is there always an impact?
That's a common misconception. Actually, the sources indicated about half of people with CP have typical cognitive abilities, but intellectual disability can be present. Communication difficulties, though, are very common, even separate from intellectual ability.
Right. And physical issues beyond just movement control.
Yes, things like muscle contractures, where muscles get permanently tight scoliosis, which is curvature of the spine, or hip dislocation can develop over time. And feeding difficulties, as we touched on, are quite prevalent too.
It's a long list. It really shows CP isn't just one defined thing.
Not at all. It's very individual.
So given this huge range of potential issues, how is CP treated or managed? I know there's no cure, but the sources were clear there's a lot that can be done to help.
That's absolutely right. No cure currently, but the focus is all about improving quality of life, maximizing independence, helping people reach their potential.
And starting early is key.
Crucial. Early intervention makes a huge difference. The sooner you start therapies and support, generally the better the outcome.
And it takes a team, doesn't it?
Oh, definitely. It's a multidisciplinary approach. You'll have doctors, maybe surgeons, physician assistants, nurses, all sorts of therapists, the physical, occupational, speech language, psychologists, educators, social workers, dietitians. It's a big team. And having a primary care provider coordinating it all is really important.
Okay, so let's break that down. Therapies seem like a cornerstone. What does physical therapy do, for instance?
Physical therapy, or PT, is huge. It focuses on improving strength, flexibility, balance, motor skills like walking, and overall mobility. They also teach families techniques to use at home and help figure out the best adaptive equipment, like braces or walkers.
Okay. And occupational therapy, OT, how's that different?
OT focuses more on independence and daily life activities, things like dressing, eating, writing, using the bathroom. They also help with adaptive equipment, but often things like specialized seating, wheelchairs, tools to help with daily tasks.
Making everyday life easier.
Exactly. Then there's speech and language therapy. They work on clear speech, obviously, but also things like using sign language or communication devices if speech is very difficult. And they're vital for helping with eating and swallowing problems, too.
Right, that connection again.
And don't forget recreational therapy. Using adapted sports or activities can be great for motor skills, confidence, and just, well, fun and emotional well-being.
That sounds great.
And mental health support is important too, helping manage potential depression or anxiety. Social workers help families navigate resources, and educators adapt learning environments. It's really comprehensive.
It sounds like it. What about medications? Where do they fit in?
Medications are mainly used to manage specific symptoms. A big one is muscle tightness or spasticity. Oral relaxants like baclofen or diazepam might be used.
Okay.
Sometimes injections like Botox directly into tight muscles can provide temporary relief. It helps relax them.
Botox, like for wrinkles.
Same substance, different application. It blocks nerve signals to the muscle. And for really severe spasticity, especially in the legs, sometimes a baclofen pump is surgically implanted.
A pump.
Yeah, it delivers the medication directly into the fluid around the spinal cord. This can give more targeted relief with potentially fewer side effects than taking it orally.
Interesting. Any other uses for meds?
Botox can also sometimes be used to help reduce excessive drooling. And of course, medications are essential for managing seizures if epilepsy is present or treating other related medical issues.
Okay. And surgery, when is that considered?
Surgery can be an option for a few things. Orthopedic surgery is quite common.
To fix.
To correct things like contractures, improve bone or joint alignment, or sometimes lengthen tight muscles or tendons. The goal is usually to improve mobility and reduce pain.
Makes sense.
There's also a more specialized neurosurgery called selective dorsal rhizotomy, or SDR.
How does that involve?
It involves carefully cutting specific nerve fibers in the spinal cord that are contributing most to severe leg spasticity. It's usually considered when other treatments haven't worked well enough.
That sounds quite complex.
It is. It requires a very specialized team.
And one source mentioned nutrition being particularly important, especially for bones.
Yes, definitely. Because of mobility issues and sometimes medication side effects, Bone health can be a concern. So getting enough calcium, vitamin D, and phosphorus is important. Dietitians often help ensure nutritional needs are met, especially if there are feeding difficulties, working alongside speech therapists.
Right. And we mentioned assisted devices, braces, wheelchairs, communication aids. Those are obviously key tools too.
Absolutely vital for independence and participation for many individuals.
So thinking long term, CP is a lifelong condition. What does living with it generally look like?
It's incredibly varied, as we've said. The outlook really depends on the severity of the CP and the support available. But the good news is, advances in care mean life expectancy and quality of life are continuously improving.
That's encouraging.
Yeah. How much help someone needs with daily self-care really depends on their specific challenges. Some people are very independent, others might need lifelong support.
And health needs continue into adulthood.
Definitely. Regular health checkups are vital for adults with CP. Monitoring vision, hearing, muscle tone, checking for seizures, managing pain or fatigue.
Dental health too.
Yes, dental, orthopedic issues, heart and lung health, mental health, it all needs ongoing attention.
And the source is really stress support for caregivers. That seems critical.
Absolutely critical. It can be demanding work, physically and emotionally. It's so important for caregivers to accept help, to not try and do it all alone.
Where can they find support?
Local support groups, online communities, organizations like the Cerebral Palsy Foundation or United Cerebral Palsy, they offer fantastic resources and connections. You're not alone in this.
That's a key message.
And there are practical resources too, developmental checklists, information about early intervention or special education services for kids, and adult disability services later on.
And the goal is always independence, as much as possible.
That's always the aim at every age, fostering independence. And caregivers often become amazing advocates, making sure their loved one gets the support and opportunities they need.
Okay, one last area of prevention, or maybe risk reduction. Is there anything that can be done to prevent CP?
Well, generally, CP isn't considered preventable because often the cause is unknown or unavoidable, but there are some things that can lower the risk in specific situations.
Like what?
For very premature babies, giving the mother magnesium sulfate before delivery seems to offer some brain protection.
Magnesium sulfate, okay.
For full-term babies who suffer oxygen deprivation at birth, asphyxia cooling therapy, basically lowering the baby's body temperature for a few days, can reduce brain damage.
Cooling therapy, wow.
Prescription caffeine given to preemies to help stimulate breathing might also have a side benefit of reducing CP risk, some research suggests.
Caffeine. Interesting.
And maybe corticosteroids given during premature labor to help the baby's lungs. There might be a link to reduce CP risk there too, but more study is needed.
And just general healthy pregnancy practices.
Absolutely. Avoiding substance use, managing conditions like preeclampsia, those are important for any healthy pregnancy and can indirectly lower some risks associated with CP.
Right. This has been, well, incredibly informative, a real deep dive into cerebral palsy. We've covered a lot. What it is, the causes, diagnosis, the huge range of effects, and all the ways it's managed and supported. Hopefully for you, the learner, this gives you that solid, accessible overview we aim for.
Yeah, I think the main thing to remember is just how variable CP is. Everyone's experience is unique, but the progress in treatments and support is genuinely hopeful. It really comes down to that personalized care plan.
And that team effort.
Exactly. The doctors, therapists, families, and the person with CP themselves, all working together.
Absolutely. And maybe here's a final thought to leave you with. When you consider all those different pathways that can lead to CP and the incredible spectrum of how it affects people, what does understanding this condition really tell us about, well, the sheer complexity of brain development, and maybe also about the resilience, the strength of the human spirit when facing these kinds of neurological differences?
That's a powerful thought.
Something to mull over as you digest all this information we've explored today.